my beauties. So today's video is going to focus on non-surgical, quick and easy in-office procedures that you can do to get your summer body ready and feel your best during the summer months. And many of these treatments we do every day in our office, and they mostly take less than 10 minutes and have amazing results and can keep you out of the OR and minimize the risk of having post-operative complications, scars, and all the other things that come from surgical procedures. Minimally invasive procedures can make a huge difference with body contouring and making sure that you look your very best for the summer months. So Emsculpt is a device that we have in our office, and Emsculpt uses a technology called high FEM technology. And that stands for high intensity focused electromagnetic energy that allows muscles to have a super contraction, a higher contraction than just working out alone. And we often use Emsculpt, and I use it myself, on my abs, my glutes. You can even use it on your quads, your calves, your biceps, and your triceps. And it's equivalent to doing 20,000 squats in the gym in a 30-minute time period, or 20,000 crunches or sit-ups in the gym. So afterwards, your abs will be a little bit sore, but not as sore as they would be if you were in the gym doing a really intense workout, because of the mechanism of action and the way it works, how it delivers the pulses, and how it does this intermittent kind of pulsating treatment to remove any lactic acid. So you do get a little bit sore, but not as sore as you would be if you were getting the same intense workout at the gym, which makes it a perfectly convenient, amazing adjuvant to working out. And I wouldn't say it's a substitute for working out, but an adjuvant to muscle building and leaning out for the summer months. Typically with an Emsculpt treatment, you do 4 sessions in a 2-week time period, and those results are good for about a year. But sometimes you'll want a little pick-me-up or touch-up before a vacation or before a pool party or before an event. And usually I'll do it, for example, I'm in Hawaii right now with my kids. I did it right before vacation just to kind of like give myself a little extra oomph. Now, I personally work out 5 to 6 days a week. I do Pilates, I lift with my trainer, and I do spin, which is my favorite indoor cycling class for my cardio. But doing Emsculpt has really helped define and fine-tune my body, because doing sit-ups and squats and leg day in the gym will get me to a certain point, but doing Emsculpt on top of it really just takes it to the next level, you guys. It's like chef's kiss. It's just amazing because it really just helps really snatch and define that body contour, especially, I'm 47 now. So after 40, you kind of have to work a little bit harder, and even working out at the gym 5 to 6 days a week and eating clean, I just needed a little extra pick me up, and I feel like Emsculpt takes me there. Also, when you look at the physiology, for my science nerds out there, the pathophysiology and the way the electromagnetic energy works into the myocytes or the muscle cells is it causes a supra contraction. It's higher and more intense than a regular contraction that you get from the neurological mind-body connection. It has this intense electromagnetic energy that you can kind of titrate up when you're getting the treatment to take it to a level to where you really, really feel that burn, and you really feel that super contraction that you get that you can't just get in the gym on your own. It's kind of like when you're on your last rep, or you're doing crunches or sit-ups and you're on your very last one, and you hold it there and you kind of almost feel your muscle cells tightening even more than they had throughout the whole workout, because you have to get to a certain level to get to that point. Emsculpt gets you there right away. So it's a super efficient, highly, intense, very easy and very comfortable workout that you can do to kind of augment what you're doing in the gym. It's not for everyone, and I always say it's not a substitute for working out and exercise, but if you want to just take your body to the next level, Emsculpt will get you there. I'm obsessed. I have it. My patients love it. Now, a lot of people may ask about Emsculpt. There's other forms of Emsculpt that do skin tightening and other things. M-Face for the face. I'm not a big fan of M-Face for the face, because for muscle contractions in the face, that's kind of what we try to get the opposite, effect of doing Botox in the office to kind of minimize the appearance of, fine lines and wrinkles and laugh lines and things like that. So you wouldn't want to do a contraction in the face for those muscles, but for muscles on the abs, the glutes, the calves, the quads, the biceps, the triceps, it really, really works really well. The other Neo, I believe is what it's called, that does skin tightening, I don't feel like it's the best option, because if someone wants skin tightening with muscle building or muscle hypertrophy or having, increased muscle mass, you would want to do like a Thermage with a Emsculpt, because Emsculpt's the best at muscle hypertrophy and growing your glutes or your abs or your muscles. And Thermage is, in my opinion, one of the best skin tightening devices. So it's kind of like you wouldn't want to use a device that is good at one thing and kind of good at the other. You want to use the one that's good at one thing and good at the other thing. For example, Emsculpt for muscle strengthening and the Thermage for skin tightening. So I hope that makes sense. Other questions people always ask about Emsculpt: where can you use it? And we already kind of went over the areas where we can use it: the abdomen, the glutes, the biceps, triceps. Also, the reason why Emsculpt works is because it induces the fast twitch and the slow twitch muscle fibers. When you're in the gym alone, it only induces the slow twitch muscle fibers. So to get the fast twitch muscle fibers to be induced and stimulated, it's impossible to do when just working out alone. So because you're getting those fast and slow twitch muscle activation, that's why Emsculpt is next level in the results that it gives. Also, there's a lot of at-home devices. They're just not as strong or powerful as the in-office Emsculpt is. So if you wanted to try those at home, I think it would be fine, but don't be disappointed when you're not getting the results from the at-home devices that you're getting in the office. Another point that I'd like to mention is that there is a little bit of fat reduction in the Emsculpt treatments using the high-fem technology because your muscle fibers are activated and the metabolic rate goes up. There has been research and studies to show that it decreases the adipose tissue, now, which is the fat layer laying over our muscles. Now, there's cool sculpting, there's Kybella, there's liposuction that are just treatments just to reduce fat. So Emsculpt isn't marketed by the FDA, and nor do they have the clinical trials to show that it decreases fat. But we do see in our in-office procedures where before and afters that fat is diminished, and that has been shown in studies to be secondary to the increased metabolic rate and activation of those myocytes. Another in-office procedure that's really popular in our office is Kybella, which is an injectable fat dissolving solution. It's called deoxycholic acid, and it's a naturally occurring enzyme that is made to break down fat. So we use it to inject those stubborn areas of fat where diet and exercise alone will never touch, especially after menopause or during the perimenopausal period. Our bodies, for women, just hold on to fat in certain areas where we didn't have fat before. And it can be very frustrating and annoying, especially when you're eating clean and you're working out. So Kybella, deoxycholic acid, the injectable fat dissolving solution, is used to treat like bra fat, back fat, abdominal fat that's stubborn, especially in the lower mid-abdomen, medial thigh fat, and then fat sometimes that gets accumulated in the medial knees. I see that a lot in my postmenopausal beauties. Our bodies will start to hold on to fat in certain areas that they didn't before, and your body, it's almost like a survival mechanism. Postmenopause will hold on to fat in those areas, and even if you're super leaned out, even people who are on Ozempic, sometimes people who are eating clean and just exercising every day will still have those little stubborn areas of fat, and that's where Kybella really comes in to just clean up the rest of the work and to decrease that fat in those stubborn areas where diet and exercise alone won't touch. Now, the way it works is it lyses, which in science means disintegrates, the fat cells. And once those fat cells are gone, you never make new fat cells. Existing fat cells can get larger or smaller depending on your diet fluctuations and exercise regimen if that changes, but you'll never make that fat back. So the results could be considered permanent if you continue on your path of the same diet and exercise routine that you're having at the time of treatment. So the downtime is pretty negligible. Sometimes there could be a little bit of bruising. Sometimes, usually if people are on, blood thinners or Advil or fish oil, can be more prone to bruising. So, take your arnica and do all the things that you can to minimize bruising. There's a little bit of swelling, but not much. The swelling that's the most problematic is the area under the chin, which we call the double chin. So treatment in this area will sometimes cause swelling, which is an unfortunate area to have swelling because then you look like you have this double chin that's worse for about a week, but then that retracts back and the chin gets, lifted and that area is chiseled under the chin. But for body contouring, which is off-label use of Kybella, it works really, really well. Usually only maybe 2 to 3 treatments are needed. Usually 50% of the patients do great after just one treatment with body contouring with Kybella. The area under the chin can be a little bit more stubborn and require maybe 2 or 3, sometimes 4 treatments spaced about 6 to 8 weeks apart. And again, the biggest downtime for under the chin is swelling, and for the body, the swelling is pretty negligible. You can usually just work out right after. There's really no downtime, and it takes about a few weeks for the results to show. I know when I've done Kybella on my abdomen, like 1 week later, it's just snatched. And when I put up my, my Lululemon or my Aloe sets, my leggings are really nice and tight, and I feel flat and firm on my abdomen, which I love. And so Kybella will get you those results pretty immediately. I would say within a week from personal experience as a patient using it. But for my beauties who I treat in the office, usually, it's about 1 to 2 months at most. And then if you want to have a second or third treatment, you space that out about 6 to 8 weeks. But Kybella is one of my favorite treatments because it gives gives a very even distribution of the fat reduction, unlike liposuction, which can kind of have that topography or that irregularity where you can almost see where the cannula was going in from the surgical procedure. I'm not a huge fan of liposuction. However, if you do have an immense amount of adipose or fat tissue there to be reduced, sometimes liposuction would be a better option. But for those who just have a tiny little bit of that stubborn fat, Kybella really does really well with reducing that. And I feel that from the inflammatory cascades of the product, there's a little bit of skin tightening that happens too. So unlike liposuction or cool sculpting, you don't have to worry as much about that skin laxity. Now, the caveat is for my more mature beauties who are very collagen depleted, like 60 and 70, in the sixth decade of life, sometimes there may be a little loss of elasticity that will not make you an appropriate Kybella candidate. But if that's the case, there's other things that we can do to tighten the skin on top. We could do biostimulatory fillers, we could do Thermage, Ellacor, microcoring. There's a lot of different things that we can do. But for all intents and purposes, Kybella is a great fat reducing injectable that's easy, low risk, and it gives really beautiful, natural looking, even results, which is kind of more beneficial than liposuction or cool sculpting that can have bad side effects that you definitely want to stay away from. So another common procedure for getting our bodies ready for the summer months includes skin tightening and different procedures that we can combine for tightening skin not on the face. So for example, the inner arms, above the knees, abdominal skin, legs. So any area of the body, we can use certain combinations of treatments or treatments to improve the skin texture, quality, and collagen, especially with collagen loss or loss of elasticity in these areas, especially after having babies with the abdominal skin for many of my beauties. Women who start to get kind of that collagen depletion that shows in the inner forearm above the knees. So there's certain things that we can do in the office with beautiful results that have minimal downtime, minimal risk, and are easy procedures that are done in the office that take less than 10 minutes. Biostimulatory fillers are usually used in conjunction with devices or lasers to help improve skin texture and tighten the skin in those really stubborn areas to get us ready for our bikini bodies in the summer months. So what we usually do is we'll combine different types of treatments, and it all depends on the degree of laxity, the location of the laxity that we're treating, and different combinations that we can use. And it all just depends on the skin thickness and a lot of other factors that we use when we do a clinical assessment in the office. So biostimulatory fillers include Sculptra, which is polyallolactic acid, Radiesse, which is calcium hydroxyapatite, and then I wouldn't call this injectable a biostimulatory filler. However, it is a skin smoothing injectable, and that is Skin Vive. It works wonders on neck laxity and the chest laxity, but it can also help with the inner forearm laxity, above the knees, and abdominal skin as well. So all of these injectables can be used on their own to smooth skin, or if you need a little bit more tightening, sometimes we combine them with devices. It could be Thermage, it could be Ellacor microcoring, it could even be like a CO2 or Fraxel laser. But I do feel that the best results when there needs to be a lot of skin tightening comes from biostimulatory fillers. Sculptra is one of my favorite fillers that works really well with, say, for example, Thermage. Thermage uses radio frequency, and it helps stimulate collagen synthesis from the fibroblast cells through a different mechanism of action. It's heat in the form of radio frequency, versus polyallolactic acid in Sculptra is like a chemical stimulant to stimulate the fibroblast to make collagen. So you're stimulating the same fibroblast cell through two different mechanisms of action. One is a chemical induced signal transduction cascade from Sculptra or a biostimulatory filler, and the other way is through a device. It could be soft wave or all therapy, although Thermage is my favorite, so I'm not even going to talk about those other devices because Thermage gives reproducible next level results, and it's one of, it's my workhorse in my office. I wouldn't have a Thermage if I didn't have great results with it, and that's why I don't have the other devices. But to be all inclusive and comprehensive, you can use a Thermage or a soft wave or an Othe, or I wouldn't say microneedling, because microneedling has its own slew of negative side effects like thinning of the skin, hyperpigmentation, infection, other things as well. So microneedling is not my favorite for skin tightening on the body, but Thermage and biostimulatory fillers, especially with Sculptra, are the ones that we do in the office with next level results. Very happy patients. Patients fly in from all over to see me for this treatment, especially on the abdominal skin, and patients do very well. Now, usually you need more than one treatment. You'll see improvement after one session, but usually about 3 sessions are needed, spaced about 1 month apart, but everyone is different. So I feel that biostimulatory fillers in conjunction with energy-based devices are chef's kiss for tightening the skin. Also Ellacor, which is the new microcoring technology, can be used off-label for abdominal skin and areas like the arms or above the knees. And it works really, really well. And we can also combine that with biostimulatory fillers. So Ellacor, for those of you who don't know, is a new microcoring technology. It's a new treatment that was FDA approved to treat moderate to severe rhytids, which are wrinkles on the lower face with skin laxity. And it's a skin excision type of device. And it basically just pulls the skin and excises the skin to help tighten up lower face laxity. But it's used off-label on the abdomen, neck, chest, arms, legs for skin tightening in those areas. Also, although it is off-label, it's talked about in many of our academic meetings with well-esteemed and respected colleagues in this field of laser medicine and cosmetic dermatology. And I myself have been using it for over a year now for body contouring with amazing next level results. So combining these treatments to tighten skin is probably one of the most common treatments that we do in the office, in addition to Kybella and Emsculpt. So building muscle, decreasing fat, tightening skin, those are the take-home treatments in the office that can be done without surgery, without the downtime and risk of surgery, and to get your summer body ready. And at 47, I swear by these, and it's kept me out of the OR. So these are the treatments that I do on myself and I do on my patients with amazing results. And I hope that this sheds some light and knowledge on this subject for you guys. All right, happy summer.